So, first things first. We are going to focus here, here, and here. Really just like we did last week. You guys have already seen this. So, you can use those exact same positions that you were using to stretch that tissue. Make sure you get over the elbow because we know that some of these cross the actual elbow itself. Take your time, slow on down. Do a couple stretches here, slide down, one in the middle, and then one down towards the wrist. And like I said last week, you can kind of do this a couple ways. You can stabilize and stretch. You can pinch your scapulas together. You can do the cross arm method, whatever works best for your body. You're gonna replicate that exact same thing when you pronate to the forearm, okay, on the inside for the flexors, except the difference is you, instead of targeting over the lateral epicondyle, we're gonna be targeting the medial epicondyle, just like last week. So you'd stretch through there, slide down to the mid, stretch through there, slide down, and stretch again. Now, the technique that I usually like to do for the wrist is, especially on the flexor side, is I will grab a little bit higher, stretch down, and then I will do the opposing direction there. Okay, but really, I want you guys to start thinking how you're going to approach this, because you don't have to do it exactly like I do it, but you got to follow the same properties. Deep strip the muscle after you stretch it with the length of the muscle. You let the muscle paint your lines for you. Okay, so you got to get your gears turning a little bit more too.
Are you saying you're doing all the stretching and rolling before?
Yes, just like any other any other NMT treatment, we start with the MFR, then move into the other stuff. Now,
can you remind me how long you hold that stretch? Is it a minute?
A minimum of 60 seconds, yes.
Okay.
Yeah. And the reason for that is because if we don't, then the muscle or the fascia does not have enough time to adjust. Then you're just going to continue exactly what we covered last week, which would be the rolling. Now, if you want to think about how nice this can flow, you can stretch the lateral portion, come in, stretch the flexors, and then when you're done with the flexors, you can just go right into your skin rolling. Again, I like to start pretty proximal to the elbow. The flexors, you're going to have to coax a little bit because this tissue, especially right up and through here, is a little bit more sensitive than the outside as far as skin and fascia is concerned, just because this gets less sun, etc.
And you're always working lateral to medial?
Well, in this case, yeah, because if not, then what we would have to do is we would have to go crossbody, and that would be really poor for our body mechanics to go the opposite direction. So you will just roll. And again, you can kind of use that little rock technique where if you want to do the whole thing all at once and not have to double up, you can go just like this. Then that way you double down, you get brachioradialis, you get the flexors, and you get the extensors all the way down the line. Okay, we did this last week, so I'm not going to spend a bunch of time covering this again because it's pretty much just the same thing, since we have to make sure we get brachioradialis in there. Now, step 2. I assume this is deep stripping FRS with an open palm.
Yep, using the open palm, begin deep stripping FRS 6 to 10 times to the wrist flexors, from the crease of the wrist to the crease of the elbow.
So, we are going to start with some open palm, like Sunshine is saying there. And again, making sure you got just enough either lotion or cream on there to maintain the skin drag, because you can see I'm still dragging on the skin and I'm not just pressing and sliding. And we are going to go in quite a few different lines all the way up from the wrist to the elbow. And your thenar eminence is your best friend on this. And usually after about 2 or 3 passes, I'm going to switch to my outside hand so that I can then control where the ulna is receiving pressure with my thenar eminence on my outside hand, because then it slips really nicely just right over top on the muscle all the way up. And then you're going to allow your hand to pronate so that you follow that line of the radius there, or excuse me, of the ulna. Lighten up as you approach the epicondyle. Now, usually what I'll do is I will just focus extensors on this portion, then I'll pronate and do the flexor, or supinate, excuse me, and then do the flexors. Once you have done the open palm, you're going to go right in to some deep stripping, and I will usually use the T, which is where I've got one hand coming this way. My direction is following the actual tissue direction for the muscle, so I'm going linear with it, but I'm using this opposite thumb to kind of separate and move that tissue out of the way so that I keep brachioradialis over top of the radius. And then very slowly, you can get to the point to where, right there, a good one. And then go right to that epicondyle, lighten up over the epicondyle, and then just do a little scoop with it. Now you can, if you have this much pliability, so we've actually got quite a bit of movement in brachioradialis already. If you've got enough to where you can push that towards that medial portion, you can just go right into that pincer compression and hit that right there without really having to worry too much about coming back and doing each individual line, going to brachioradialis. Let it flow. This is where you get to be creative. So I need you guys to start trying to be a little bit creative with these.
Soften brachioradialis anyway in order to get
Exactly. In Zoe's case, I can really just move this one out of the way
Soften it in order to get to the soften.
and to get right into supinator, right through it. So you're not always, so you're not always going to need to get brachioradialis out of the way if they're coming to you where you can actually just go ahead and deviate it laterally or medially. But once you're done with brachioradialis, which is what we covered last week, you're just going to go right back down on that line. And keep in mind, about this lower third here is the majority of it is tendon. Doesn't mean you shouldn't go over it, but it just means you're not going to need to crank really hard on that. Just apply pressure, toss in some of that cross fiber friction as you perform your deep stripping lines, because that just feels really good on tendons. And what I'm kind of doing is occupying that nice little space there in between both the radius and the ulna, and then using either one of those bones to pin the muscles into as we friction to really kind of get everything separate and move really nice. Then I'm going to switch this hand actually, because we're approaching some of those trigger point spots. And right here, you just go ahead and let me know whenever you get to about mild discomfort.
There.
Perfect. And you can do a lot of different things when you're treating trigger points for the extensors. Your best friend's movement. So what I'm going to have Zoe do is we're going to do a contract relax. And so now that we're at mild, I'm just going to have you very gently extend your wrist right into my forearm. A little bit more, right there. And you want it just enough to where you start feeling that tensing up. And you're going to hold. Zoe, take 3 to 6 really slow and full breaths for us. And as Zoe inhales and exhales, we are going to friction both linearly and cross fiber. And again, with my hand, I'm doing 0 pressure with my index finger. I'm just using that because it's a little bit more pinpointed than my thumb is. Because this one feels kind of about the size of a small Tic Tac.
You're using the radius to push up again?
Yeah. And then once you slowly come out of those breaths towards number 4, 6, I'm gently going to decrease my pressure. So again, all the pressure is coming from my left hand in this instance. And we'll lighten up and do a nice open palm right over all of that we just worked on. Then you just continue. Now, my favorite technique to do is actually a alternation between pronation and supination. So when you get down to, you can do it the whole time, but when you get down to extensor carpi ulnaris, it works really well. So what I like to do is I'll take kind of like that Spock grip, and I will grip on both sides so that I have complete control. And I mean, you can just do the handshake technique, but I prefer this because I don't know, it just feels better for treatment. It doesn't feel like I'm like, hi, I'm Darren Cadwell, it's nice to meet you. So, but then what we're gonna do, you've got this little portion here, the radius. Now I'm gonna go the ulna, I'm gonna go all the way up that line using this pronation movement and supination movement back and forth between them, coupled with flexion and extension to get that muscle to do what I need it to do. And then the other thing I will do is I will reach my grip down closer towards the elbow, and I'm just going to squeeze in, and then using extension, it will move your thumb up that line. And then you can rotate right in to supination to really peel that extensor carpi ulnaris right off of that bone. And right here, you let me know when you get to about mild discomfort.
There.
Perfect. and we're just gonna hold. And then in this position, what we're gonna do is the friction is all gonna come from the wrist movement. So pronation, supination, extension, flexion, but we're gonna do minute moves. Like this right here is enough to friction that side that we're talking about. All the while we're coaching Zoe to take good, slow, deep breaths. Can also do some extension and flexion of the elbow just to move your thumb across that tissue. And then gently come out as you continue friction. Now extensor carpionaris, especially as you get close there to the elbow, or excuse me, that lateral epicondyle is gonna get kind of tender. So I will go through with a couple of open palm passes just to make that nice.
If you were treating the whole arm, would you start with flexors and extensors, or would you start with deltoid?
It depends. It depends on like what we were talking about earlier. You know, if you've got a really intense numbing, here, that thing finally moved. Did you feel that, Zoe?
Mm-hmm.
Then if we've got some numbness and tingling, I want to see if it's being caused from up here first, and then I'll work my way down. But if not, then I usually start at the hand and work all the way up.
Okay.
So basically, that's what the extensors are going to look like all the way through. And again, you know, you can toss in some stretches. Personally, I'm not a huge fan of performing extensor stretches on your client, just because it's hard to gauge how their wrist is feeling if you're not good at communicating with them. And I find it easier for them to control on their own. So if I do any stretches, usually what I will do is I will come down here to the tendons to friction them by thus flexing the wrist, which usually feels pretty good. Okay. Then I assume it is either friction at the attachment site or it's moving on to the flexors and then repeating this process.
After trigger points are treated, isolate medial epicondyle, perform linear and cross fiber friction to the common flexor tendon.
Oh, that one started on the flexors. That's okay. So we're starting on the extensors. It really does not matter. But for the friction, when we're coming up here, isolate, identify where that lateral epicondyle is, move about a thumb width below, just like we do on all the other friction. Sink your thumb in, compress, and then friction all along that line. And again, this is on a lot of clients, it's not going to take that much pressure because this is a pretty tender area. But you want to move about 3 to 5 millimeters at a time as you're doing this. It's a really small movement, and we have shown through studies, so you gotta let me know if the pressure's too much.
Yes.
I see you squinting.
Yeah, sorry.
So, because there's no contraction here, so I can't tell that.
I mean, it didn't hurt. It was just like really uncomfortable.
Okay. So you gotta let me know that.
Right.
So, yeah.
I mean, it wasn't like a pain. It was just uncomfortable.
Okay. Well, we're gonna keep on frictioning here. So keep on frictioning through there. I'm gonna be a little bit lighter. And then, but like what I was gonna say is cross fiber friction has been shown to be very effective, especially with an epicondylitis situation, not just algia, in helping decrease inflammation and increase fibroblasts and collagen disposal to the area. So once you've done your friction, I'm gonna hit it with some more kind of petrissage, lift that tissue all up and away. And then if you wanted to target, or if you need to target supinator, move. We're gonna do slight elbow flexion so that way I can control this. Move, brachioradialis out of the way. Slide right there behind that. And then I'm gonna take control of the hand again. And we're just going to supinate and extend just like so to treat, okay? So you basically strip this one really similar to how you would all of the other ones as you go through those lines. Now, we are gonna move on to flexors. It is the same exact process. And the other thing I want you guys to look out for, number one, their elbow is not here. Doesn't feel good. Number two, that they are not extending their elbow, because believe it or not, they'll do it all the time. So if they're doing that, take some of that tension off by gently resting it either on your wrist or your forearm so that it is deactivated. And then you can test by doing this, and if it is limp, then you know they're not activating anything. But if it stops like that, then they're still trying to control the situation. So you just got to get that deactivated. we're gonna go through, put some lotion all through here first.
It's kind of a dumb question.
Never a dumb question, Elliot.
Well, my brother doesn't deactivate, right? Would it be beneficial just to spend like a lot of time trying to, like you drop
Okay.
his arm and it just stays?
Yeah,
Okay.
I would spend quite a bit of time. Also, gentle rocking motions
Okay.
work really good. Not jostling. Well, jostling can, but I'm not gonna jostle the forearm.
That makes sense.
Yeah, because that would be
There's not really much to jostle.
yeah. And the whole idea with if we're doing jostling, we are trying to displace something, and if you're jostling on brachioradialis, because that's what you'd be trying to displace, it's not going to be comfortable over top of that radius. That rapid compression
So the
movement.
jostling is more to displace than getting the muscle to lessen its contraction.
You're trying to deactivate that contractile protection response with the jostling. Your approach for your flexors. So these, when you look at your extensors, it's kind of a nice straight line until right about here. Then they curl back a little bit to go to the lateral epicondyle. This is a little bit different with the flexors, because even if you isolate this elbow right here and you completely straighten that wrist as it should be able to get to complete supination, what you've got is you've got the muscle tract that runs to right about here, and then it really starts curling underneath to move towards this common tendon right here. So you gotta watch your line, because if you go straight, you're gonna be digging right into some neurovascular space, right in through here, and a place that is pretty uncomfortable to have a thumb dug into. So with that, I'm gonna use my outside hand. I'm gonna ride the radius, and then once you feel, did you skip lunch?
I did.
And then once you feel that tissue start shifting, then you can slowly follow towards that attachment site. And then you're definitely going to lighten up as you approach that medial epicondyle. And then just rinse and repeat. You can use either hand. You're going to move about a thumb width at a time. And you're going to lighten up as you hit that epicondyle. Usually for the lower portion, I will switch.
It's normal to like feeling your fingers, right?
Some referral.
Yeah. I mean, it's just like tingling.
Tingling, and you got some other stuff going on. So we're going to take a little bit more pressure off of this area through here. And again, you might run into hitting, because of the exposure of the nerves through here, you might hit them. It's okay. Just don't spend a lot of time compressing on spots that are causing tingling. But I think we get into this state where we kind of freak out the second our client feels any numbness or tingling. That's a normal response of the body sometimes. If you cross a nerve, or you compress a muscle that contains a nerve. Now, as we're getting through here, we talked about watching out for that ulnar nerve. You can identify where that's going to come right through here. We've got the lateral epicondyle and the neolecranon, and that little groove as it comes down through. So what I'm going to do is I'm going to flex the elbow just like I did before, compress in, and then extend to allow myself to kind of cross over top of that without riding all along the ulna towards that groove. Because that's where you're going to run into a lot of like, ooh, I've got some feeling some finger stuff. Go down this line, again, 5 to 6 lines, depending on how large the forearm is, from medial to lateral, or from lateral to medial. Continue all through there. If you really want to test pronator, then what you can do is I'm just going to support right here, and I just want you to gently flex your elbow. You'll feel it pop up right there, and relax. Boop. Pronator isolated from here to here. Usually, I will supinate to neutral, pronate to neutral. I'm switching those up bad today. Pronate to neutral, and then as you do your movement, what you will do is you will supinate to lengthen and extend that elbow as you go through those lines. Obviously, this will be much slower when you're actually doing it, but it's the same idea. Opening all that up. Then you would go back through, isolate trigger points. I'll usually cut the whole forearm and squeeze in like so. Now, also, some individuals take a lot of pressure, so you can use your forearm or your elbow. You're just gonna have to be very proficient and make sure you know where you're at when you're doing this. and that you're definitely lighting up as you approach those epicondyles, but you can definitely do that with ease. You can perform some mild contract relax. I go very, very mild on the contraction for the flexors because these are affected, usually hypertonic already, so I don't want to continuously stress them. So I'm just gently going to extend the wrist a touch, hold right across the palm, squeeze into mild discomfort, and then I would have Zoe very gently flex your finger pad or your the pads of your hand right into my thumb by flexing your wrist. There you go. And then that would tense all of that stuff. And then you can relax. You would perform that same treatment. 3 to 6 deep breaths, work really slow. If it didn't change, always remember to check in with your client. If nothing changed, then you can perform another trigger point compression for 3 to 6 more deep breaths and then move on. So, but you want to know if anything changed here. If it doesn't, move on after about attempt number 3, because we don't want to overstress that muscle. When you are doing the friction, which is I assume what is next for this, to the medial epicondyle and the attachments, what you're going to do is that same kind of technique using the flexion and extension to cross fiber for you, and then you're just going to use the direction with your thumb. But again, our pace is like so. Really slow, really controlled. And then that friction for cross fiber, you're going to squeeze in. And you can also do some little circles just to make contact with the whole elbow. I'll kind of petrissage all around this area sometimes because it feels pretty good. I don't do that every time, but it just depends on how much this is fighting me. And then, what else you got?
Kind of off script.
Do what? I'm kind of off script. Let's see here. Yada, yada, yada. Treat, trigger points, compression, friction, close out flexors with open palms, and then you're making nice again, so you're just kind of backing out. You're doing more open palm effleurage to make nice. And then lastly, you can perform a flexor and/or an extensor stretch to the client's wrist closeout treatment. So, flexor stretches, you can do these a couple ways. Some people find some of them to be a little bit too intimate because it almost feels like hand holding. What you can do is you can take the palm of the wrist, bring it up, and flex. You can use your palm on theirs. You're gonna wanna support the wrist to flex. And the whole idea for this is to make sure that you stretch those fingers out so that they're getting full length throughout there as you stretch through that. Now some people will interlace their hands like this and do the flexor stretch, but you're also gonna wanna make sure that this is deactivated because Zoe's holding her hand up, her wrist up right now. So I'm gonna need you to let go of that. There you go. But you can also do it like this. Honestly, I never do that one right there because just for me, it just feels like I'm holding someone's hand, which I just don't want to do.
Yeah, that was.
There it is.
But when I'm finished with all of this, it really depends on what kind of mood I'm in. I will start with the hand or I will finish with the hand. Again, it really depends. I'm gonna use a little bit of lotion. And how I do this is we're gonna start by making nice with the whole structure in a neutral position by gently tractioning and pulling all the way out. Steal the rest of that. And then work your way down into the hand. Now, what I do for this is I'm going to alternate on the pinky and the last 2 fingers in between the thumb web and down the first 2. With a heavy focus on this guy right here, on the thumb. Because your adductor pollicis is extremely strong and you can do a lot of cool stuff with this. So you can actually hold like so, compress in and extend that joint back. If you do this, do not grab this knuckle to do that. You want to grab the one that is secondary right here. And I will honestly wrap my thumb around or my fingers around here so that I can feel the tension level in this joint as I stretch.
Are you pincer compressing the
I
web?
am. So you can see I'm squeezing all the way underneath, compressing into that thumb web and lengthening it. You can petrissage by going around that joint, compress and squeeze as you work all along adductor pollicis. Now how I do the finger work, what I do with this is I couple linear and circular at each knuckle because it just feels really good. Because you can, if you're just doing this all the way out, you're missing all of this in-between space. So take your hand and your thumb and perform those nice firm circles, and just take your time all the way out to the tip of the thumb, and then just relax. Then what I'm going to do is I'm going to work each individual metacarpal, and I'm going to be compressing on top first, just to get through those tendons. Go into the carpals. You see how those tendons will move. Then I'm going to pinch both sides into a pincer compression and just target this first metacarpal as I gently work all the way out. So I'm pincer compressing in on both sides, squeezing, pulling, and I'm working to move those metacarpals in opposite directions. Because we forget about this a lot, it feels really good. Are you excited about that, Elliot?
Yeah.
Are you on the tendon, like, or?
Yes, I am right on the tendon and the actual bone itself. So we're pulling that out because we often forget to mobilize these just a little bit. Excuse me, not a true mobilization, just taking the range of motion, if you will. And then once you get to that first knuckle, same thing. Circular friction all around it. I usually do about 3. And then I'm gently gonna pull and repeat this process. And I'm gonna show you with speed what this will end up looking like. I usually switch to my outside hand for the middle finger to the last 2. Circular friction and continue the process. One thing that really gets on my nerves, really gets on my nerves, is when the client will stick their finger out for me. And like, quit that. You're not doing that, Zoe. I'm just saying.
No,
It is something where like you'll come out to here and they'll do that, and I'm like, all right, cool. You just, and then you kind of just are stuck. So I don't know why, but boy, that just gets on my nerves when a client does that. I'm like, can you just not lay here and just relax for an hour?
They always do it now.
Every time. Every time. It's just kind of that, just like that right there. And I'm like,
I think they think they're helping you.
they definitely think they're helping.
Yeah.
But it's one of those situations where it's like, it's
It's a weird dichotomy. It's like I'm helping you by turtling up and becoming very difficult to work with.
exactly.
That's an appropriate time to yell at the client?
Now, the last thing I want to do, I'm actually going to tell a story about that here in a second. The last thing I'm going to note, you have about 40% of grip strength from here, about 40% from here, and about the last 20 from the middle for those fingers, okay? I was very unaware of this until I broke this hand about how strong your pinky side is. Those last 2 fingers are really strong. So make sure to give them the same amount of attention that you would give to the thumb. So I'm gonna kind of circle all around that pisiform, which feels really good. And then again, continue to work all the way up that line, circular friction, and then finish all through there. Now, the last little thing that I will do, which I do to the feet as well, and I love having this done, is I will grip those 4, and I will, this takes a little bit of practice. It's gonna be a waterfall. So I'm gonna lift up on that first digit, I'm curling my fingers to push up on the second, then I'm starting to push down as I allow, and it's this movement that you force the wrist and the metacarpals into this really nice like waveform. Feels good. And then the last thing, the last thing before I close out is I'm going to do circular friction on all these carpals so that we don't forget about them. You can do linear and circular all through there. You can even do it on those on the most distal portion here of the radius and the ulna as they meet this whole area. I'm just not hooking my fingers up and into this medial canal. Okay. You can also take and spread at the base of the hand, which feels really good. And then to close out, what I will normally do is I will reach up, I'll grab the arm, I'll do another couple of those nice firm compressions to squeeze out. And then when I get to the wrist with my bottom hand, I'm gonna compress in, and then just gently pull, because you'll get some traction that goes on. And then gently allow that to naturally just rest back down on the table. Now, back to what I was gonna highlight with the yelling at your client thing. I had a client that just came to me because they didn't get yelled at, but a massage therapist told them, I can't help you because you won't relax. So what do you think that reinforced? We're not relaxing on the table. So be very careful with your words when you have someone on the table. Whether it's in here practicing, watch what you're saying. Be very smart. Think about how it could be perceived by anyone other than yourself. So, and the reason why I say do that in practice, because if you don't focus on that in here, you're gonna do it in there. You just will. Any questions on any of this? Nope. So when you do yours, make sure to